Blood sugar. What you need to know. The optimal lifestyle plan for preventing diseases, diabetes, losing weight, and natural, amazing health. Written by Madison Fuller. Narrated by Catherine O'Connor. Introduction. Congratulations on purchasing Blood Sugar. What you need to know. The optimal lifestyle plan for preventing diseases, diabetes, losing weight, and natural, amazing health. And thank you for doing so. Abnormal blood sugar are one of the most serious health problems a person can develop. High blood pressure is closely associated with diabetes, and the damage it can cause throughout the body means that if you have high blood pressure for an extended period of time, you're going to be at risk for developing many health problems. High blood sugar can damage nearly every organ system in the body, from the eyes to the heart to the kidneys. Diabetics are at very high risk for developing heart disease, high blood pressure, kidney problems, blindness, and even cancer. For decades, medical doctors have simply accepted diabetes. The focus has been on managing the disease with pharmaceuticals once people come down with it, rather than on managing it naturally or even preventing it in the first place. This approach has not been all that successful. When attempting to manage a disease with pills and insulin injections, the health of the patient gradually worsens over time. Higher and higher doses of medications become necessary, and eventually they may not work at all. The patient is then forced to live a life that centers on constant injections of insulin, making day-to-day existence a never-ending battle. There are always risks of having blood sugar go too high or having it drop too low by accidentally injecting too much insulin. Even when the patient is able to manage it properly, the pain and difficulty of having to use insulin injections to lead a seemingly normal life becomes overwhelming. And even then, health will continue to worsen in many patients. If you want to live a life of having to constantly worry about while being completely dependent on drugs and insulin injections and facing worsening health down the line, you can follow the conventional approach. But these days, more and more people with blood sugar problems are taking control of their own health. Many of them are even throwing away their medications and using completely natural means of managing and even reversing their diabetes. The good news is that you can do that too, and we'll be showing you some of the ways you can do it in this book. You may be experiencing your own problems with high blood sugar and even diabetes right now, and you may have had friends and relatives who've dealt with these problems. In my own life, I've had many friends that succumbed to the disease. Some friends were not that diligent about keeping up with their medications and insulin injections. As a result, they ended up with major health problems. One man I knew developed several sores on his leg that wouldn't heal, and they ended up having to amputate it. He ended up dying at a young age and spent his last years suffering. I have a history of diabetes in my own family. My mother was diabetic, and I saw what it did to her. Although she lived a long life, she was dependent on insulin and drugs for several decades. When you're in that situation, you can't just sit down and eat a meal, especially if it's something like a birthday celebration where people might have cake or other sweets like ice cream. She had to constantly stay on top of her insulin injections, taking daily medications, and doing everything at just the right time, centered around her meals. And despite all that diligence and living an active life with lots of exercise, she developed many of the complications that result from the disease. This included needing a triple bypass in order to reduce the risk of getting a heart attack and problems with her eyesight that led to partial blindness. Naturally, given the hereditary tendencies of the disease, I was always worried about it. And over the years, my weight crept up, and so did my blood sugar. Soon, I was solidly in the pre-diabetic range. I will be telling you what that is in the book. Despite following standard recommendations and doing some exercise, I developed high blood pressure, and my blood sugar readings kept going higher and higher until finally they were in the diabetic range. At that point, my doctors gave me one last chance. If I didn't succeed, they were going to put me on medication. So, I dove into the research and found out the latest discoveries on diet, lifestyle, and exercise.
Sample complete. Ready to continue?